So welcome everybody to our basic medical abbreviations learning session with Skype. Today we're going to learn just some basic and common medical abbreviations used by professionals, healthcare professionals in the healthcare setting. And we're going to learn a lot about medical abbreviations, their origins, and basically why they're considered to be kind of like a language and a culture per se. So welcome in. All right, so our agenda, we're going to first discuss the history and the origin of medical abbreviations and the patient history report examples. We have a few examples to show you what they look like on a patient history report. Then the rules of medical abbreviations, how they relate to interprofessional communication and education, because that's very important to know. You know, we're the student interprofessional education organization, so we have to know why they relate to this topic of interprofessional education and communication. And then we will give you some common medical abbreviations used by nurses, SLPs, physical therapists, occupational therapists, social workers too, as they're all in the healthcare setting. And lastly, we'll end with a little challenge. So make sure to grab a piece of paper or have your thumbs ready, because everybody's going to be answering in the chat, and it'll be a very collaborative thing. So, all right. So first, the history and origin of medical abbreviations. So medicine is a field of abbreviations intended to make communicating lengthy medical terms more efficient. So they're used to replace many medical terms and phrases that are lengthy to make it easier and quicker for healthcare professionals to communicate with one another. Most medical terms are drawn from other languages, particularly Latin and Greek. And this is from Peterson in 2016. So the basis of it all is that it's important for communication. It makes it easier and efficient for communication, because, you know, medical terminology can be long and lengthy, and yeah, a lot of root words in Latin and Greek involved. So, all right. So, I think it's cut off a bit on the left, but this is our first example of what they look like. I'm pretty sure everybody has like a bit of an idea of what they look like. It's just a bunch of like little abbreviated words. So notice the word patient, shortened for PX, TM for tympanic membrane. I'm pretty sure a lot of SLPs students know what that is. The abbreviation NC/AT stands for normocephalic atraumatic, which just states that the head is of a typical size and there are no signs of injury.
All right, so example number 2, this one is specifically a physical therapy chart patient case. So on this one, you'll notice the use of L for left, specifically left shoulder, and R for right shoulder to describe the PT or patient's ROM, range of motion. And the chart also says he requires further HEP, which is home exercise program.
And our third and last example, again, patient complains of lower back pain, LBP on her right leg. The patient exhibits no signs of high blood pressure, and their attending physician is Peter Lennox. So as you can see, all the highlighted words and letters there. Okay. All right.
So how does learning about medical abbreviations relate to interpersonal communication and education? So here's a statement by Hull. In increasing multilingual healthcare environments worldwide, ensuring accurate, effective communication is requisite. Language proficiency is essential, particularly medical language proficiency. Medical language is a universal construct in healthcare, the shared language of health and allied health professionals. It is highly evolved, career-specific, technical, and cultural bound. A language for specific purposes its function differs significantly from that of a standard language. Proficiency requires, at minimum, and a common understanding of discipline-specific jargon, abstracts, and then I'm going to need help with this word somewhat.
Euphemisms.
Euphemisms, abbreviations, and acronyms. Wow. I mean, this is like, this statement is just saying like it needs to be like very specific and at most
Yeah.
Proficient.
Thank you, Rebecca. All right. So we're gonna, now that we've learned a bit about the background and history and the importance of medical abbreviations, we are now going to teach you guys some of the basic medical abbreviations that are specialized or just used mostly by specific medical professionals. So first, we will show you some nursing medical abbreviations. Then Kendra will show you some common abbreviations used in speech language pathology. Janet will show you some used in physical and occupational therapy. And lastly, Rebecca will teach you guys about social work medical abbreviations. So I will be starting with nursing medical abbreviations. All right. So out of bed is an important one. I'm not gonna, or I do want to say that I won't be, for the sake of time, I won't be explaining all of them. I'm hoping some of them will definitely be common sense or explained for. But out of bed is a common used medical abbreviation. So is blood pressure, PERLA, which means pupils are equal, round, reactive to light on accommodation, which is a good sign. Nasogastric tube, very important for SLPs and nurses to know this one. PO is orally, that means you can take food orally. Intramuscular, oops. Oh, did I, okay. Intramuscular, which means it's where shots that go through the muscle. EEG, brain imaging scan, regular rate and rhythm, chest x-ray, and blood urea nitrogen. And here are some more nursing medical abbreviations. ABG, arterial blood gas, ICU intensive care unit. Pretty sure we all know what that is. BID or BID 2 times per day, shortness of breath for SOB. AC is before meals. SBAR, situation background assessment and recommendation, which is an important form for interprofessional education and communication. Past medical history, PMH or PMHX, PT for patient, PX for prognosis, and HOV, head of bed, which I think we did repeat that one. Oh, out of bed is different from head of bed. All right. Let's get on to the speech language pathology.
All right. Can you guys hear me? I'm in Folsom Hall, so it's kind of hard to speak. Okay, so for the first abbreviation we have MBSS. This is for a modified barium swallow study. And then we have VFSS, which is a video fluoroscopic swallow study. CN for cranial nerve, COPD, chronic obstructive pulmonary disease, CVA, cerebrovascular accident or a stroke, OM for otitis media, OTO, otolaryngology, ENT or ear, nose, and throat, and PO means nothing by mouth, MBC, maximum breathing capacity, and LX for larynx. And then we also have some other speech language pathology abbreviations. This is more like school-based. We have CCC-SLP, which is the Certificate of Clinical Competency in Speech Language Pathology. We have IEP for an individualized education plan, IFSP, Individualized Family Service Plan, ASHA, the American Speech Language Hearing Association, AOS, Apraxia of Speech, DDK, Diakinesis, FCD, Final Consonant Deletion, EI, Early Intervention, IPA, International Phonetic Alphabet, PA, Phonological Awareness.
Okay, so now some common physical and occupational therapy medical abbreviations. Hopefully the background talking isn't too bad, but for occupational therapy, a lot of these are very like used in both of them, but we tried choosing some specific ones for each one. So AD assisted device, and this could be anything like mobility aids, wheelchairs, scooters, prosthetic devices. A&O, alert and oriented, BID, twice per day. CO, complaints of blank. Um, COTA, certified occupational therapist assistant. DJD, degenerative joint disease, and sometimes this is also known as osteoarthritis because of that connection with the joints. ECC or EKG, which is like electrocardiogram. FX, so fracture. GSW, gunshot wound, and HA for headache. For physical therapy, 50% WB refers to 50% weight bearing. So this is how much weight a person puts on or through an injured body part, whether that be a leg or back, etc. LTG, long-term goals. MM, muscle. MOBS, mobilization. OOB, out of bed. We heard that one in another field, so you can see some connections in there. PMHX, past medical history. PTA, physical therapy assistant. Q for every, and then QD, every day. S without the SANS. I'm not a physical therapy major, so I'm not completely sure what that might be, but if anybody does know, feel free to explain that. SBA, standby assist, which is the person assisting is not touching the person. They're kind of just standing around to make sure the person, like if they lose balance or something, they can go and assist.
Okay, so common social work medical abbreviations. So the first one we have here is AHCD, which stands for Advanced Healthcare Directive. And this is like something you'd have, you give to the hospital. It's like a form that they give to you and they keep at the hospital, or you can have it like with your will. It's basically at like end of life, or if you're unable to speak for yourself, you can choose or select somebody to do for you, like to speak for you. PT is very common, obviously, for patient. 5150 is an involuntary commitment to a psychiatric hospital for up to 72 hours. And it's based on a clinical determination that the individual is either at risk to themselves or to others, or they are gravely disabled. ALR is assisting living residents. HIPAA or HIPAA is the Health Insurance Portability and Accountability Act of 1996. BX is behavior. TX is therapy or treatment. VRS is vocational rehabilitation services. WRAP is wellness and recovery action plan. SX is symptom.